A clinical nurse specialist, or CNS, is an advanced practice registered nurse with a master's or doctoral education that concentrates on pharmacology, pathophysiology, physical assessment, leadership, and population health. CNSs have had an influence on patient care, nursing practice, and system outcomes in healthcare for over 60 years.
The American Nurses Association describes the CNS as the clinical expert in evidence-based practice nursing within specialty areas such as pediatrics, adult health, geriatrics, and women's health. As a clinical nurse specialist, I collaborate with interprofessional teams across the system to coordinate the care of women with high-risk pregnancies. As a result of this collaboration, the maternal mortality rate has been reduced in the Atlanta region. Let's look at some of the ways the CNS practices here at Emory Healthcare.
As a clinical nurse specialist, I'm a consultant. I co-lead the system-wide CAUTI prevention team with Dr. Jesse Jacob. As part of a comprehensive CAUTI reduction bundle, we developed a nurse-driven catheter removal protocol. Our outcome was a 9% decrease in CAUTI for Emory Healthcare overall for fiscal year 18, which led to a cost avoidance of over $80,000.
As a clinical nurse specialist, I'm involved at the system level for several initiatives, including the design, the implementation, and evaluation of programs. An example of this is sepsis, which is a leading cause of morbidity and mortality. In recognition of the impact this disease state has had on our healthcare system and our patients in both cost of life and financial resources, Emory Healthcare identified sepsis as an opportunity to impact change. I led an interprofessional team to develop a process of care that included protocols, procedures, and multiple departments, resulting in a decreased mortality around 30% and a total cost savings of greater than $3.3 million.
As a clinical nurse specialist, I collaborate with interdisciplinary teams. For example, I co-lead the Emory Healthcare CLABSI team with Chief Medical Officer and Epidemiologist, Dr. James Steinberg. This collaboration reduced central line days through the use of midline catheters and reduced the risk of infection through the implementation of alcohol caps. Additionally, we expanded our Emory Healthcare Vascular Access team across our hospitals. Through this collaboration, we achieved a 17% overall decrease in CLABSIs and a cost avoidance of over $700,000 for Emory Healthcare in fiscal year 2018.
As a clinical nurse specialist, I coach and mentor staff. Recently, I mentored clinical nurses in developing a quality improvement project to increase our number of certified nurses on the unit. The nurses created a certification station, which included educational information and study resources. As a result of our work, 53% of eligible nurses became certified.
As clinical nurse specialists, we use research to design and develop evidence-based practice. These projects drive the development of protocols, policies, and procedures. This has a direct impact on best patient outcomes, improving quality initiatives, decreasing length of stay, and promoting safe patient care. We are proud to say that 80% of CNSs have published, presented nationally and internationally, or co-authored nursing literature. In addition, 100% of Emory Healthcare CNSs are leading evidence-based practice initiatives.
As the Chief Nurse Executive for Emory Healthcare, I recognize the value and celebrate the contributions of the clinical nurse specialist. You just heard many examples of these contributions, and in addition, with our changing healthcare system, our clinical nurse specialists lead change that benefits our patients, nurses, and clinical teams. They are part of our fabric of Emory Healthcare.
So now that you know what the CNS does, where will you find them?